Most men won't admit this, but if you're leaking urine after you pee or struggling to get or maintain an erection, it's not just frustrating, it's humiliating. And the worst part? The longer you ignore it, the more permanent it feels. But here's the truth, it's not. I'm Dr. James Ellison, a board-certified urologist with over 30 years of experience helping men in their 60s, 70s, and beyond reclaim control, without pills or surgery. What you've been told about aging and male health, it's incomplete. Because the key to fixing these issues isn't just in your bladder or penis, it starts with one overlooked muscle group, your pelvic floor. And today, I'll walk you through 4 research-backed exercises that can improve bladder control and restore stronger, longer-lasting erections in just minutes a day. But there's a catch. Doing them wrong can make things worse. So stay with me. I'll guide you step by step and reveal the number 1 mistake most men make. Most men make, don't give up on yourself. Let's rebuild from your foundation and get your power back before we get started. If you haven't already, make sure to hit the subscribe button and turn on the notification bell. That way you'll never miss another video focused on restoring your confidence, strength, and control. And if this topic speaks to you, type 1 in the comments to let me know. It helped. If not, type 0, so I can keep improving and create content that truly supports your journey. Now that you understand what's really causing these issues and what's been holding you back, let's get into first exercise that starts to turn it all around. It's simple, safe, and it's where real progress begins. 1. The flick-cule, gentle activation of the pelvic floor. When most men hear the word Kegel, they immediately think of squeezing hard and holding for as long as possible. But here's the problem. If you're over 60 and you haven't trained your pelvic floor before, doing it that way can actually make things worse. It's like going into the gym and trying to deadlift 200 lb on your first day. You'll strain something, you'll get frustrated, and you'll probably stop doing it altogether. That's why I teach what I call the flick-cule. This version is safer, smarter, and far more effective for men in their 60s and beyond. Instead of holding the contraction for long periods, we're going to gently turn the muscle on and off. Think of it like a light switch: flick on, flick off. That's all. Here's how it works. Start by lying down on your back with your knees bent and your feet flat. This position helps take pressure off your core and lower back so you can isolate the right muscles. Place one hand on your stomach. This is important so we don't want your abs to do the work. Now place 2 fingers over your perineum, that soft area between your scrotum and anus. This is where you'll feel the muscle activate, if you're doing it right now. Take a deep breath in through your nose and slowly exhale at the very end of your breath. When your lungs are completely empty, gently contract the muscle as if you're trying to stop yourself from urinating. Hold that contraction for just 1 second, then release. That's 1.
Repetition. It should feel like a subtle lift or tightening under your fingers. Not a hard squeeze, not a strain, just a controlled flick. You'll do 10 of these in the morning, 10 more around lunchtime, and 10 at night while lying in bed. That's it. 30 reps a day. No equipment, no side effects, no pills. And yet this simple routine has helped countless men stop urine leakage, reduce urgency, and even begin to notice stronger, fuller erections, all by waking up the muscles that time, tension, and age have put to sleep. And this is just the beginning. Urine. Because while the flick-cule activates the right muscles, there's another hidden force that might be sabotaging your progress, one that most men have never even thought about. It's sitting right beneath you. Literally. Let's talk about it next. If you're still here and finding this valuable, type the number 1 in the comments to let me know you're following along. Your engagement helps me keep creating content that supports your health and confidence. Now, let's move on to the second exercise. 2 glute release with a tennis ball. Unlock pelvic tension, Most men are shocked when I tell them that their tight glutes might be the reason they're still leaking after urination or struggling with weak erections. But it's true, you see, the muscles in your hips and buttocks are directly connected to your pelvic floor. If those muscles are tense, overworked, or inflamed from years of sitting, bad posture, or lack of stretching, they pull on the pelvic floor and lock it up. It's like tightening a rubber band so much that nothing can move freely. Not blood, not nerve signals, not even muscle contractions. And when that happens, no matter how many Kegels you do, you'll barely make progress. That's why one of the simplest, yet most powerful things you can do is release that tension using nothing more than a tennis ball and a chair. It might not sound impressive, but the results speak for themselves. Here's how you do it. Sit on a firm chair like a kitchen chair or even a dining room bench. Place the tennis ball under one side of your glute, right in the thickest part of the muscle cross. That same leg's ankle over your opposite knee like a relaxed figure. 4 position, then slowly lean into the ball. You'll know you're in the right spot when you feel a dull, achy pressure. Not pain, but definitely something you've been ignoring for a while. That's the tension we're trying to release now. Breathe deep, calm breaths. Let your body relax into the ball. Hold for about 30 seconds, then switch sides. Don't rush it. This isn't about forcing change. It's about inviting your body to let go over time. This simple practice helps increase blood flow to the pelvis, relaxes chronically tight muscles, and creates the space your pelvic floor needs to function properly. Some of my older patients even report improved lower back flexibility and easier bowel movements just from this one technique. The beauty of the tennis ball release is that it requires zero skill and gives you an immediate sense of connection to your body. It's grounding, it's simple, and it works. But the truth is, loosening the glutes is only half the battle because deeper still beneath the surface in the most sensitive and often ignored part of the male body. There's a muscle group that holds decades of tension, and if you're brave enough to address it, that's where real change begins. Let's go there. Next 3, perineal pressure release. Advanced pelvic relaxation. There's a part of the male body most men never think about until something goes wrong. It's not visible in the mirror, and it's not something we ever talk about. But the perineum, the area between your scrotum and anus, is the gateway to your pelvic floor. And if you're still dealing with dribbling after urination, or your erections just aren't as firm as they used to be, this area might be the root of it all. As men age, tension builds in the pelvic floor like layers of scar tissue stress, sitting too long, straining during bowel movements, even years of shallow breathing, all of it creates tightness deep in the core. The problem is this tension becomes so constant you don't even realize it's there, but it's working against you every single day, silently weakening your ability to urinate fully, or maintain a strong erection. That's where the perineal pressure release comes in. It's a gentle but powerful way to deactivate this hidden tension and restore blood flow and mobility to the deepest pelvic muscles. And all you need is the same tennis ball you used before. Start by placing the tennis ball on the seat of a firm chair. Slowly lower yourself onto the ball using your hands on the armrests for control. The ball should rest directly beneath your perineum, not pressing into the bone, but resting in the soft space just behind your scrotum. You'll likely feel a strange, deep kind of pressure, not painful, but definitely noticeable. This pressure helps break up chronic tightness that has been blocking your progress as you sit on the ball. Breathe deeply and focus on letting go, not just physically, but mentally. This is a vulnerable position, but also a deeply healing one. Hold for about 30 seconds, adjusting slightly forward or backward. If needed to find the most effective spot when you release, you may notice an immediate sense of relief or warmth in the pelvic area. That's circulation returning, that's healing. Beginning this technique is advanced but profoundly effective. I've had patients who tried every pill and pelvic gadget on the market, only to discover that real change came from this simple release. And once that tension is gone, your body can finally do what it was meant to do. But we're not finished yet, because there's one final movement. Simple, quiet, and deeply restorative that ties everything together. A stretch that not only opens your hips, but unlocks the very center of your strength as a man. Let's finish strong if you're still watching and these insights are making a difference for you. Type the number 1 in the comments to let me know you're here and engaged. Now, let's keep going and dive into the 4th and final exercise. 4. Happy baby stretch. Open the groin, relax the pelvic floor. There's a reason ancient stretching practices have stood the test of time when done correctly. The right stretch can unlock areas of the body that have been locked down for years, sometimes decades, and when it comes to men over 60 dealing with pelvic tightness, weak erections, and that lingering drip after urination, few movements are more powerful than the happy baby stretch. Now I know the name may sound odd, maybe even a little silly, but don't let that fool you. This stretch is no joke. In fact, it's one of the most targeted ways to lengthen the inner thigh and groin muscles which directly connect to your pelvic floor. When these muscles are tight, they pull the pelvis inward, making it harder to fully empty your bladder and reducing the blood flow. That's essential for strong, lasting erections to get into the position. You'll start by lying flat on your back. Bring your knees up toward your chest and lift your feet toward the ceiling. Then reach up and grab the outer edges of your feet with your hands. Here's where most people go wrong. They keep their knees too close together. What you want to do is use your elbows to gently push your knees apart, bringing your feet to about shoulder width or even wider. This is where the magic happens as you open the hips and stretch the inner thighs. You'll feel a gentle release deep in the groin. Breathe slowly and deeply, allowing your body to relax into the stretch. Hold this position for 40 seconds, then rest and repeat one more time. You should feel a sense of opening, maybe even a little trembling. If you haven't moved this way in a while, that's good. That's your body waking up over time. This simple stretch can create more space in the pelvis, reduce tension in the pelvic floor, and restore proper muscle balance. And for many of my older patients, it's the key to finally feeling in control of their body again. It's not about flexibility for the sake of it. It's about unlocking the systems that control everything, from bladder function to sexual performance done consistently. The happy baby stretch becomes more than just a posture. It becomes a powerful tool for daily release, deep relaxation, and recovery. But the real magic happens when we bring all 4 of these exercises together into one simple, consistent daily routine. So let me show you exactly how to do that. Step-by-step daily routine summary for best results. Now that you understand each exercise and how it works, the real transformation begins when you put them together into a simple, consistent daily routine. And let me be clear, this isn't about overtraining or spending hours on the floor each day. It's about building a rhythm that supports your body, fits your lifestyle, and restores your confidence quietly and powerfully, day after day. Here's how to begin every morning before your day picks up speed. Take 5 minutes to lie down and perform 10 flick-style Q, gentle controlled contractions, flick on, flick off. This starts your day by waking up the pelvic floor without strain at lunchtime. Take a few minutes, whether you're seated at the kitchen table or in a quiet corner at work, and do another 10 reps. Then at night, right before bed, do your final 10. You can even do them lying down, relaxed, and ready to sleep. These 30 daily reps are more than enough to build strength safely over time. Now let's add the release work. Choose 3 to 4 days each week to do the tennis ball glute release 1 minute total. 30 seconds on each side. Do it after long periods of sitting or while watching TV on those same days. Follow up with the perineal release using the tennis ball. Take your time, lowering onto the chair. Find the right spot and breathe through the discomfort. That deep pressure will unlock years of tension you didn't even know you were carrying. Finally, every night commit to the happy baby stretch. Just 2 rounds of 40-second holds. Do it in bed or on the carpet before you wind down. This final stretch will calm your nervous System release your hips and send your pelvic floor into true rest mode so it can do its job tomorrow naturally and without effort. Stick to this for just 2 weeks and you'll start noticing change. Stick with it for a full month, and others may notice it too. This is how men at 60, 70, even 80 years old start walking taller, breathing easier, and reclaiming a level of control they thought was gone for good. But there's one final piece I need to share with you, because while consistency is key, progression is what unlocks real lasting results. So before you go, let me explain how to keep improving safely and how to avoid the biggest mistake that holds most men back. Conclusion: if you've made it this far, it means something inside you is still fighting to reclaim what time, stress, or silence may have taken away. And that fight is something I deeply respect, because the truth is, dealing with urine, dribble, weak flow, or fading erections isn't just a physical burden, it's emotional. It touches your sense of dignity, your identity, your relationships, even how you see yourself in the mirror. But now you have the tools to start changing. That we began with the Flick-Cule, a safe and effective way to gently activate the pelvic floor without strain or confusion. You learned that it's not about squeezing harder or holding longer. It's about building control, breath by breath. Then we turned to the glutes, unlocking the overlooked tension that builds up from years of sitting stiffness and stress. You discovered how a simple tennis ball could free the muscles that anchor your pelvis, allowing circulation and function to return. We went deeper with the perineal pressure release, an exercise few men have the courage to try, but one that delivers powerful results. It helps you access and soften the core of pelvic tension, the silent force holding back your progress. And finally, you learned how the happy baby stretch, while simple in appearance, can open the deepest structures of your hips and pelvic floor. It's not just a stretch, it's a doorway to release healing and balance when all of these pieces come together into a daily rhythm. 30 Kegel. A day, 3 to 4 release sessions a week, and a nightly stretch, you begin to rebuild from the inside out. This isn't about chasing youth. It's about restoring function, confidence, and peace in your body. I've seen men in their 60s go from avoiding intimacy to feeling proud in the bedroom again. I've seen men in their 70s stop using pads for dribbling and finally enjoy a full night's sleep. I've seen men in their 80s stand taller, walk stronger, and smile more. This change is real, and it's possible for you too. But if you want to take the guesswork out and follow a proven step-by-step plan, I created a complete 8-week blueprint designed specifically for men your age, your body, and your goals. It's the same progression I give to my private clients, and it's helped hundreds find lasting relief and renewal. When you're ready, I'll walk you through it. You've come this far. Let's take the next step together. If this video gave you hope, clarity, or even just a small step toward feeling more like yourself, again, I'd truly appreciate it if you hit the like button and shared it with someone who might need it too. There are so many men silently struggling with these issues, and your share might be the reason someone finally finds the answers they've been searching for. I also want to hear from you. Leave a comment below and let me know which part of this video spoke to you the most, or what topic you'd like me to cover next. Your feedback helps me create more of the content that matters to you. And don't forget to subscribe and turn on notifications so you never miss a video designed to help you live stronger, longer, and with the confidence you